Good afternoon. Welcome to the press briefing. On the panel, we have Dr. Chuang Shuk Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. First of all, Dr. Chuang will give us an update of the cases. Good afternoon. As of last night, 897 cases were reported to us as a result of PCR tests. 1,638 cases reported to us as a result of RAT tests, so a total of 2,535 cases. For a cumulative number of cases, 1,175,631. 737,603 by way of PCR tests, and 438,028 cases as a result of positive RAT tests. Among the 897 cases reported last night, 156 from the Hospital Authority, and then another 151 from our own laboratory, and then the rest from private laboratories, 591 of them. As of in relation to our own laboratory, 683 cases were subject to our analysis for variants. 680 of them were absent from L452R variant. 673 were tested negative for L452R. In other words, they are Omicron cases. There are 10 cases for which the viral load is too low or the analysis has not yet been completed. Among yesterday's cases, there were 13 imported cases. 9 were arrivals yesterday. 6 on 6, 7, 9, 8 from Indonesia. Another 3 cases came to Hong Kong via other flights. And then the rest arrived earlier, not yesterday. They were arrivals previously. Yesterday, we didn't have any new RCHEs with staff members or residents getting infected. But then, for homes that have already reported cases, we still have 49 new cases of infection in relation to residents, and then another 11 staff members were involved. In fact, 32 are RCHEs and 7 are RCHDs, that is homes for the disabled. Among the death cases, the Hospital Authority has reported an additional 62 cases. The total 8,433 reported by the Hospital Authority. There were another 56 reported by our pathology or forensic doctors, and then another 2 from CU Hong Kong, so a total of 8,492 cases of death with a positive result. Regarding the 8,492 cases, 3,452 male, and then 5,040 male. And for the age range from 11 months to 112 years old, the median is 86. And then we have a lot of them age 80 or above, and then 86% or above were people age 60 or more. And then the death rate is 0.72. And then for those aged elderly, 80 or above, 9.97%. Death rate for those unvaccinated, 2.9%. For those 80 years old or more, 15.84%. And then for those aged 60 or more, 6.3%. And then for those with 1 dose, 0.15, with 3 doses, 0.03. But then the figure is 0.93 for those aged 80 or above. In other words, having 3 doses when compared with 1 dose or 2 doses, it is more effective. With 1 dose, it is still better than unvaccinated altogether. So that's it from me today. Well, in fact, we have noticed that in relation to the declaration platform for the RAT, there are citizens who think that they need to report their negative results to us. It is not necessary. You only need to report to us when you have a positive outcome. Dr. Lau, please. Good afternoon. Currently, 9,282 patients are at our public hospitals, North Lantau Infection Control Center, and our Infection Control Center, as well as the COVID-19 Treatment Center at AWE. 3 more patients are critical. 17 are in serious conditions. For those residing, staying at the ICU and being critical, there are 66 of them. As of 00 hours today, for the past 24 hours, 53 patients with a positive result passed away. 35 men and 18 female. Age range between 58 and 107. Among those who passed away yesterday, 34 of them came from homes. 34 of them did not have any vaccination status, 13 with 1 dose. In other words, 47 of them have not completed the vaccination comprising of 2 doses. In other words, the percentage is 88%. 5 of them had 2 doses, 1 with 3 doses. For those aged 65 or above, there were 48 of them. Let me also talk about 2 particular cases. They were relatively younger. First of all, a 58-year-old man. This patient had some cancer conditions having spread to other parts of the body, the liver, the brain, and the skeletons. On the 5th of March, as a result of low oxygen levels and also breathing difficulties, he was admitted to an A&E department, and he had a positive result of the PCR test, and the CT value was 16, and he was admitted to our medical ward. And while he was in the ward, he was given different kinds of treatment. But then he had a number of underlying conditions, mainly because of his endocrine cancer. So unfortunately, he passed away at about noontime. And then there was another 60-year-old man. This patient had also got a problem with his motor neurons. So he had to be bedbound all the time with swallowing difficulties. And in fact, he had some pneumonia, which is of an inhaling nature. He also suffered from high blood pressure as well as diabetes. On the 3rd of April, he had fever and he was tested positive upon admission to our hospital. He was given oral medicine for COVID-19. Unfortunately, he was in poor health conditions as he was always bedridden. And unfortunately, around about 00 hours, he passed away. As a result of the backlog of numbers, I would like to tell you about the 9 additional patients who passed away between now and the 7th of April. 5 males and 4 females, 9 of them aging 58 onwards. Another 1,000 patients have recovered and were discharged. 7 patients were found to have a positive result of COVID-19 virus upon screening and admission. 8 other patients were regarded as close contacts. So far, 21,628 staff members were infected, and 20,379 have already recovered and returned to work. Thank you.
Floor is now open to questions. Please hold up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The lady at the back. Cable news. For the rapid antigen test results, do they include the positive results as a result of the 3-day self-test exercise? What's your take on the figure? Does the self-test exercise work? Do the numbers fall within a range that's expected? Do the figures suggest a certain number of silent transmission chains in the city? How many death cases were there yesterday? Just then, Dr. Tran mentioned 62 deaths, but 56 were reported by the forensic pathologists. 56 deaths reported by forensic pathologists. And then 2 cases were reported by the TMHK Medical Center. So could you clarify the death figures from yesterday? The reported figures today regarding the RT platform show an increase compared to the figure yesterday. But the increase is by no means an exponential increase. Well, that's certainly a rise compared with yesterday. For PCR positive tests, the number has dropped to 800 odd cases overall. If there were no call upon the people to take the RT, both figures would have dropped. But the RT positive figures have risen as a percentage of total cases. We've looked at the cases reported on the RT platform. 60+% are symptomatic and 30% will be asymptomatic. But based on the figures reported yesterday, 30% were symptomatic, 60-70% were asymptomatic. That means some people responded to the government's calls about taking the RT test. That is, they took an RT test despite having no symptoms. Other indicators of COVID, whether it's the restriction testing declarations or the surveillance monitoring spots, show a downward trend in the positive cases. So this figure may be an indication of where things stand in the community. In terms of our death figures, we don't have any fresh figures from forensic pathologists. The figure I mentioned just then is the cumulative figure. The cumulative figure from the HA is 8,433 cases with 62 additional cases. The 50 cases were from the forensic pathologist and 3 cases from the TMHK Medical Center. No new cases. Let me clarify the figures here. On the 8th of April, there were 53 deaths plus on April the 7th due to some backlog. 9 deaths were not announced yesterday. So altogether, there were 62 as mentioned by Dr. Tran just there. Next question, the lady over there. I'm from Mingpao. A question about the RT test. How many such tests were done on April 8th? Based on the figures about the asymptomatic carriers, how many people have responded to the government's calls about doing the RT test? How many such cases are suitable for home isolation? How many such cases require transfer to isolation facilities? Dr. Tran also said that those who test negative do not have to submit their result online. How did you identify such cases, that is, people who declared despite testing negative? Could you tell us more? The chief executive mentioned the point prevalence study conducted by the HKU on April 8th. The figure was 0.36%, a recent figure. And applied to the Hong Kong population, that would be 26,000 people, even though that covers some previously infected people. But we see 1,000 or so RT positive cases every day. How come the figure we see today submitted on the RT platform differs from the figure based on the Hong Kong U study? Is it because few people are participating in the self-test exercise? The chief executive said today that the projected figure of the people could be, the cases picked up would be fewer than 10,000. But what's the CHP's assessment on the projected figure of asymptomatic cases that can be picked up through the RT self-testing? How would you comment on the effectiveness of this RT exercise? In terms of the death figures, we see a drop in the figure. You said there would be a lag between the drop in infection numbers and death cases. Now we are a month past the peak of the infections. Does that mean that death numbers would also fall off? Are the fatality rates stabilizing? 1,638 RAT positive cases have been reported. The figure includes 1,592 cases declared on the platform. We have other cases picked up on the platform dedicated to cases from elderly care homes. There are also people who struggle with their platform, so they call the Home Affairs Department or call us and report their positive result. Among the 1,592 cases, 1,272 cases were tests done on April 8th. But some people who did their test on April 8th may have submitted their result on 9th today instead. Because people will have to submit their ID card and the picture of their test before we issue the isolation order. So there may be a delay between the time when the test is taken and the time of declaration. So some people may have taken a test today and report their positive result tomorrow. We don't have any projection as to the number of silent carriers we can pick up. As for the HKU study about point prevalence, that will be of reference value. The recent figure has shown fluctuation. Sometimes it's 0.2 something or 0.36. The confidence interval may come with a range, meaning a larger level of uncertainty when the figures are at the low level. Say when the figure is 0.36%, the confidence interval may be a 0.16 and a higher figure. Applying the ratio to the city's population, a 0.36% would suggest 20,000 people, 20,000 COVID positive people, but that may cover both previous infections and fresh infections. Some people may test positive for a number of days, and when you divide up the figure, you may end up with a few thousand. So you have to bear in mind the confidence interval and its impact on the projection. We don't know what the actual situation is based on the figures from yesterday. The figures over the past few days, PCR positive and RT positive cases, both figures have been dropping. But for today, we have 800 odd PCR positive test result, and that's dropping. We were expecting RT positive tests to be dropping, but then we have more than 1,600 RT positive tests reported. That suggests people have responded to the government's calls for this 3-day self-test exercise. As for asymptomatic carriers, some of them have done an RT test and then reported their positive result online. For death cases, there's a downward trend too. That may reflect developments 2 or 3 weeks ago. This figure looks reliable, and we have a much smaller backlog than before, but we still have to monitor the development for some time. We have done spot checks all along. For those who declare a positive result online after an RT test, when a spot check returns a negative result, we look at the photos people submit. People may have thought that they have to declare even a negative result. So we want to clarify this here. The platform is for reporting positive test results. If you test negative, that is having one line, you do not have to report the result. We keep getting cases like this, but I don't have a specific number. Next question. Any English questions? The lady over there.
From the SCMP. So for the RAT positive results, do you expect an increasing trend of the number of RAT positive results in these 3 days? And any estimate on how long the daily case number will stay around the same level until it drops again? And the second question is, Education Minister Kevin Yuan said authorities are considering asking students to undergo RAT when school resumes. Should students be required to take RAT on a daily or weekly basis? Thank you.
The overall trend of the COVID positive cases in the recent weeks has been decreasing. So the number of PCR positive cases by PCR is below 900 today. But the number of RAT, the rapid test positive, has increased to 1,600 today. So this reflects the participation of the public in testing rapid tests, in using rapid tests. So because according to our previous trend, the number of PCR positive and RAT positive should be comparable in recent few days. But the number of rapid test positive today exceeds quite double of that of PCR positive. So we also analyzed the symptomatic and asymptomatic proportion among those cases. Previously, we understand that around 65% of the cases who reported through the rapid test positive platform is around 65%. But the proportion of asymptomatic cases yesterday is around 70%. So this reflects quite a proportion of asymptomatic patients who tested themselves and found they were positive. So we have found out quite some asymptomatic cases in the community. I cannot foresee the exact trend of the level of the PCR and RAT positive cases in the coming few days. Hopefully, it's still in a decreasing trend. And we are still discussing with the education authority about the measures and also the testing, etc., among the students.
The next reporter, no other questions, then that's the end of today's press conference. Sorry, the speaker didn't come through. Well, it isn't just about RAT. Even for PCR, we have also got an online platform to check whether there are high risk factors. I know that we haven't got an exact figure, but I would say that about 10% or 10+% involve high risk factors, and so the patients are not suitable for home isolation. Thank you. Thank you.